You can tell by the video, we are going to be talking about what they do not teach you in nursing school. I just feel like a lot of what I went through in nursing school was probably unnecessary. Another portion of it was just trial and error, and then another portion of it was just honestly not even knowing what I was coming into. Like, you know that it's going to be hard, but you don't know, like, in detail, like, what's going to be hard other than the obvious. So anyway, we're going to talk about what I feel like they do not tell you in nursing school, in hopes that this helps people who are thinking about going to nursing school, or those of you who are may have just started. And then also chime in and let me know, like, what didn't you know? What do you agree with? What do you disagree with, like, when it comes to nursing school? So let's get into the video. So first things first, what they don't tell you in nursing school is it does not matter if you get an ADN or a BSN. I got my ADN and I was able to do everything that I wanted to do for the career path that I had chose with no problem. I chose my ADN because it was cheaper. And also I knew that I did not want to stay in a hospital. I don't really see a difference, and people can correct me if I'm wrong, if you have an ADN versus BSN when it comes to pay. Now, I feel like if you're a staff nurse, then yes, eventually you'll want to get your BSN if you want to like move up in the ranks to be part of management or something like that. But if you just want to be a staff nurse, and for a lot of you who follow me who have aspirations of being a travel nurse, if you just want to go that route, you do not need your BSN. I've worked at hospitals that were magnet hospitals, and if you don't know, those hospitals usually require their nurses to have a BSN, but I've worked at those hospitals with just my ADN with no problem. When it came to pay rate, as far as like me being a staff nurse, there was no difference between what I was getting paid as an ADN and what somebody was getting paid as a BSN, as us both coming in as new grads. So I feel like it does not make a difference unless you want to move up in ranks within your hospital, or even just up within your degree. Like if you want to be a nurse practitioner, obviously you have to get your BSN at some point. But I think the most important part is that it is not something that you need immediately. For me, it was like, how can I make money the quickest way possible? And that was going through ADN route. You can get your BSN. It's just going to take you longer to get to the end goal. So for me, I got my ADN and started working immediately, maybe 2 months after I had took my NCLEX. But then while I was being a travel nurse, I was able to focus without the stress of like school. You know, like when you first start nursing school, getting your BSN was nothing like getting my ADN. It was super easy. It was, I don't want to say easy, but I mean, it required me to do work, but it was nothing like getting my ADN. I was doing it at my own pace. Like everything was online. And for those who don't know, I went to WGU, Western Government University, and it's a 100% online class. Like none of it is in person or anything like that. And I was just able to do that at my own pace with money. I think that was the most important part. Like I can go to school and not have to worry about my bills or, you know, like working hard. Versus with my ADN, like I had to work and go to school, and that was kind of stressful. But I say all that to say, you can go ahead and get your ADN and do exactly everything that I did. I'm a travel nurse now on my own med spa, and I was traveling before I got my BSN, and I don't think they explain that to people. Sometimes they may just want you to go in and get your BSN, but use your own judgment and what works for your life. But you do not need a BSN to be a travel nurse, nor do you need a BSN to get into a hospital in the area that I was in, and that was in Florida. Granted, that was 3 years ago, but I don't think much has changed because I still know people who are going to get their ADN and getting jobs in a hospital and not having problems. But y'all let me know how y'all feel about that. Piggybacking off of the ADN BSN, I really think that people should look into the option of like a community college to do like all your prereqs, instead of going to like a private college or a community or a public college. But these nursing programs, like the prices that I have seen are ridiculous. Like they're almost charging like what somebody would be getting for like their master's or something like that, like these private schools. So if I can make one suggestion, I would definitely look into several different programs and look at the cost. And a lot of it, I know that we may be getting student loans, but they're never going anywhere. So it's no reason to rack up money just because it's a loan for no reason. Like I definitely would recommend doing your prereqs at some community college because it'll be much cheaper and also going to a public school versus a private school. Now, I'll preface that with saying that I did go to a private school, so it's coming from a place of like I've been there, done that. But I went to a private school because it was easy for me to get into the program. Versus the public school that was in my area, they had like a waiting list, and it was just like, I'm not waiting. Like, I need to get into the field now. I need to make money now. And so that was my reason for doing it. But if I could do it over and I had a little bit more patience, I definitely would have went to a public school versus a private school. And honestly, I really don't think it's a different, like, I feel like every program is going to have its issues. There's always going to be something because it's nursing. But ultimately, like, you go in, you learn the material you need to learn to pass the test, and then you take your NCLEX and you keep it moving. Some schools, like, pride themselves on, like, oh, we have a certain percent pass rate for the NCLEX or stuff like that. I mean, like I said, just do your research, do your own judgment. But I definitely feel like going to a public school and doing your prereqs also before you actually get into the program will save you a lot of money. And it's not necessary to go to these private schools because the money that they be charging is just like, it's ridiculous. Like, I feel like I could go on a whole rant about how I feel like school is a scam. Like, obviously you need to go to school for whatever. If you need to be a doctor, you need to be a nurse, like, obviously you need to go to school. But the amount that these institutions charge to teach and the quality of teaching, don't get me on that, don't even view all of that. Like, I just feel like use your money wisely. Even if it is a loan, look into several different options. Just don't go with the first one. Ask around, word of mouth, things like that. But if I could give any advice about private versus public school, go to a public school. You're not be paying all this money for the same exact education that you're going to receive from a public school. The thing is, I feel like they don't tell you that you're going to be teaching yourself a lot in nursing school. From my experience, I didn't really have any good teachers. I feel like my teachers were there as like a second job. Like, it wasn't really something that they were passionate about or cared about. It was just kind of something that they knew that they can do. But I didn't have good teachers. I had teachers who were like, if you ask them a question, they'll be like, look in the book. Like, I had those type of teachers. So it's like, I feel like they don't tell you that a lot of what you're doing is you're going to be teaching yourself, which is so unfortunate because you have to show up for class to get credit and stuff like that. But it was just like, I feel like a lot of the stuff, I had one good teacher, and if y'all go back and y'all watch like my nursing vlogs, she ended up getting fired, but she was like one of the best teachers that I feel like we had. But a lot of it is you're not gonna get good quality teachers who know how to teach. It's gonna be like, this is the material, you learn it, you take a test. And so I feel like nobody tells you that. Like, you kind of get bamboozled into going thinking that you're about to learn all this information, or they're about to actually teach you, because this is what you're paying them for, to teach you. And a lot of teachers just don't be doing that. And so I found out a lot of times, like 90% of my whole entire program, I was teaching myself. One thing I can say is to find you a good study group. I'm talking about a group that you can trust. If you know what I mean, you know what I mean. And also a group where they about their business. You don't want nobody who in there playing and all of that stuff. Like, you're there to get through that nursing program, take your NCLEX, and keep it moving. And so I feel like finding you a tribe is very, very important. That's another thing that I think that they don't tell you. It is important to find your tribe, to find your group. As y'all know or don't know, a lot of people that was in my tribe in nursing school, I still talk to this day. Like, mostly all of us are travel nurses, and one of us I started a whole entire business with. So I would definitely recommend finding a group of people. I mean, use your better judgment. It might take a few semesters to see, because the person who you start with might not be the person who, they're semesters down the line. So it may take you a little while to kind of find who you mesh with and who you vibe with. But I would definitely recommend finding a tribe. They're going to help you when it's time to study. They're going to help you when you don't understand something. They're going to help you when you need time to vent. Y'all, when I thought that I failed out of nursing school, like, I told my tribe, and everybody just automatically started praying for me, giving me words of encouragement, telling me like, no, like, this is not final, go up there, go talk to her. Like, I needed that in my time of like despair. Like, what is all that noise? I really thought that it was done and over for me, and I really felt like it was done and over for me, and them just being there just added that extra support. Also, with that being said, learn your studying style. Every teacher may be different, and also the tests that they administer may be different. For one teacher, I might just be like a auditory learner. Like, I was the type of person, like, I would record all the lectures and just go back and just replay them until like I knew them verbatim. Sometimes you might just be a visual learner. Like, for a lot of the disease processes, for me, it helps to see like what actually happens to the body to actually understand what's going on. So just learn your learning style, and also understand that what you know, like I said, how I had two different learning styles depending on the teacher, depending on the subject. What may be one learning style for, you know, one semester may change for a different class or something like that. So that's my advice on that. Find you a tribe. Understand that you are going to be doing a lot of self-teaching, and with that comes understanding like what is your learning. Also, I feel like I didn't realize this until towards the end of my path in nursing when it came to like getting a job, but I didn't recognize that I'm always going to be stressed. Like, I was stressed in school because I needed to pass my test and I needed to pass the program. Once I graduated, it was like, oh, now I'm stressed because I have to take the NCLEX. So then once you pass the NCLEX, then you're stressed because you're like, oh, I have to find a job. And then once you find a job, then you're stressed because you're like, oh my God, I want to make sure I don't kill anybody. So it's like, with nursing, I don't think nobody explained that to me, that you're going to be stressed for quite some time. And this is not to discourage anybody, because if I can get through it, we all can get through it. But I think just having that mindset, understanding that the stress doesn't stop after you graduate. Like, the stress, I still get stressed out even on the job, and I've been a nurse for 3 years, I think, I don't know. But the stress is just never ending when it comes to nursing. Like, it is a constant flow of like one stress after the other. And I don't know if me knowing that before I picked this career would have helped at all, but it was just something that I noticed. It was just like, oh, you know, you feel a relief when you are done with nursing school, but then after that relief, then it's a whole nother form of stress, because you're like, oh, I gotta pass this NCLEX, and then it just keeps going and keeps going and keeps going, and it's just like, when does it stop? Like, it doesn't. So hopefully that doesn't discourage anybody, but more so just a form of information for you to know. But like, the stress of this career is just constant. So this is another one that kind of helped me determine what career path that I wanted to take, because a lot of you don't know, I did get into law school. But I did not go to law school because I knew for a fact that I was not going to be able to work. And so nursing was the next option, because I felt like it was something that I could do. Like, I didn't have an option not to work. Like, bills had to be paid. I was not about to go back to Detroit to go live with my parents. So it wasn't an option for me not to work. But I feel like they don't tell you that it is an option. I think like they kind of get you in there and they kind of scare you, like, oh, you're not going to have a social life. You're not going to have time to work. You're not going to have time to do this and that. And it's just like, so who gonna pay these bills? I get not having a social life, but I need somewhere to lay my head. I need to be able to pay for certain things. And so that portion of it, I don't think they advocate for, because nursing school is hard. But I want to say that to say that even though it's hard, it is 1000% possible to work. I worked full time. Like I said, I had to. Nobody was paying my bills, so it wasn't even an option. But I just say that to let y'all know that it is possible, because I know people got responsibilities, they got kids, they got whatever. Like, you might not have the luxury of having somebody to pay your bills for you. So if you're thinking about nursing and if you can or can't work, I definitely think you can. I preface that by saying that it is extremely difficult. I was very tired, but I had a job where, like, after a certain time during my shift, things kind of quiet down and I can do homework, I can study, I could do whatever. So my job was like, it gave me the ability to do certain things, versus somebody who might like have a like on the go, like always doing something where you at work, you literally at work and you can't do anything else. But it's still possible. You just have to prioritize your study time and make sure that you are on top of your stuff. And then also, I only work 4 days a week, so that also helped as well. But I say all that to say that you can definitely have a full-time job and be in nursing school. Will it be difficult? Yes. But is it necessary? Obviously, because you have bills to pay. So they don't tell you that. I know why they don't tell you that, because nursing school is hard, but I don't think they understand. They have to. That a lot of people aren't, we aren't all kids going to nursing school. Like, there were grown adults, like, with families, like 50s, 40s, going to nursing school. They don't have that option to go live with their mom and dad while they in school. So I just wanted to bring that point to view, that like, you definitely can't have a full-time job, part-time job, whatever. You can definitely work and still be in a nursing program. It'll be difficult, but at the end of the day, like, you got bills to that pay. So what's more difficult, living out on the street and going to nursing school, or just working a full-time job and having somewhere to lay your head and going to nursing school? So it definitely is possible. One thing I don't think they talk about at all, they actually don't talk about it at all, at least in my program, is how much you'll be getting paid. I don't know where we get that idea that nurses get great pay. And I know that that's relative for somebody who might be getting paid $12, $14 an hour, like $30 an hour seems very good. But for the amount of work that you will be putting in as a nurse, I don't think that they explain that to you as well. I take that back. So what they say is kind of like a subliminal, like, oh, don't do nursing for the money. If you in this for the money, you're going to be sadly disappointed. Like, that's what a lot of the teachers were saying, but nobody was really going over rates in your area. And I feel like that's important, because when I got my first check, I was devastated. I was just like, I just went through all of this for my check to be this much. I think for my job that I was actually working before I became a nurse, it was only an extra $500. So it wasn't even like I was just like, I just made this big jump from being a nurse. And I just feel like they don't talk about that in school at all. They don't explain to you. I think you have like a class where they talk about like different careers. I take that back. It's not even a class. Like, it might be a section in the book, but they don't talk about the different careers that you can have in nursing. Like, nursing is just so diverse. You don't have to go work in a hospital. You can do anything. And I don't think that they talk about that enough in nursing school. I don't know if it's just because it's like we have more important things that we need you to focus on versus like how much money you can make. But I feel like that's important, because nursing encompasses so much, and the pay that we get as a staff nurse, it's just not enough. It doesn't add up. Like, for doctors, you're going to be making a good amount of money. The hard work that you're putting in, you're going to reap the reward of the pay eventually. But with nursing, it's like, if you stay staff, like, you're not making a lot of money, especially with like how things are going up in price. It's just like, they don't talk about that enough. I guess they kind of leave it up to you to go do your own research and ask around. But I was so consumed with just like learning everything that I just assumed that nurses get paid very well. But I was sadly mistaken when I got my first check. And I was just like, even though seeing the numbers, I don't know, I was just like, it just didn't connect that this is not a lot of money. It didn't connect until I got my check, and I was just like, oh, that's all I'm getting paid? So they don't talk about that. They don't talk about like pay. And I understand like everybody's in different states and stuff like that, but they can still geared towards like that area. They don't talk about like the diversity of the things that you can do. I just think that they leave that part out. And then a lot of us, when we get into the field, we're kind of like bamboozled. Like, we have to do so much only to get paid so little. So that's one thing I would say they don't teach you in nursing school. It's like, they don't talk enough about rates and options and diversity, because you can obviously make a lot of money in the nursing field, but they don't teach you like what avenues to go down. And I get like everybody is different. Everybody will have a different career path, but I didn't even know that the aesthetic world in nursing existed. I didn't learn that in school. I learned that through like social media and seeing other people who look like me who was doing it. It was just like, oh wait, like I can do that. Like, my license affords me the ability to do that. So I feel like they don't talk about it, and they should, but it's nursing school. Well, another thing that I think is important is that nursing school doesn't teach you how to be a nurse. It teaches you disease processes. It teaches you symptoms. It teaches you medication, but it doesn't teach you how to be a nurse. And I guess what I mean by that is that a lot of it too will come with experience. Like, even if they did start teaching it, I guess that's the point of having like clinical, but my clinicals was like, it was trash. Like, I don't feel like I got a lot out of it. There were certain aspects of it that I did enjoy, but like a lot of the nurses that I was working with, like it was almost like we were a burden. And also it was only so much that we can do in our program. Like we couldn't start IVs. Like it was a lot of just like busy work, like go get some ice, go get some water, go see about this tray. It wasn't a lot of nursing involved in it. But I don't think that they teach you that. And a lot of it, honestly, you won't. I feel like clinical is the time for you to learn that. If they gave us, you know, more wiggle room to do stuff, I understand that we're not licensed, so that a nurse watching you, like now you're her responsibility. So they kind of want to keep it at a like minimum on what you can and can't do. But nursing school doesn't teach you how to nurse. It just teaches you the education aspect. It doesn't teach you how to recognize certain things, or it doesn't teach you how to like troubleshoot certain things. It doesn't teach you that at all. Like a lot of stuff I just had to learn like as I went, like as I go. Like nursing school is specifically for the education aspect, for just the knowledge part, but it's not like a hands-on type of thing, even in your clinicals. I mean, maybe some people do have good clinicals, but from my experience, like my clinicals were just very basic. Like a lot of the time I just feel like, why am I here? Like I said, there were aspects of it that I did enjoy, like my labor and delivery. I got to actually help deliver a baby. And then my mental health one, I love that because y'all just know like that's my thing. In the ED, I actually did love the ED, but I'm glad that I didn't work in the ED because I just couldn't imagine like at this stage in my career, like the constant running around. Like I'm in a stage in nursing where like I don't want to work hard. I don't want a hard assignment. I need something easy, go with the flow. In the ED, I just feel like it's constant all the time. And it's just like, I'm burnt out. I don't have the mental capacity or physical capacity to just keep running around like that. In the beginning, like, yeah, it's fun and you're learning something new. But after I got to a certain point in nursing, it was just like, okay, this is what this is. Okay, I get it. Like it was the same thing, like the same disease processes, the same treatment. You might like get a case every once in a while where like the doctors are kind of stumped and they don't know what to do and we can't figure it out or whatever. But for the most part, like everybody gets treated the same. So it was just like, it became monotonous to me, and it just became like, okay, I'm over this. Let's move on to the next thing. So I can say that, like, they don't teach you how to nurse. You just learn that through experience. But they definitely teach you the education aspect of it. And that's me also. I want to piggyback off of that about the education. When you're in nursing school, you're literally there to learn what you need to learn to pass the test. You're not going to learn everything. It's impossible. Even at this stage, there are still things that present to me that I'm just like, oh, I've never heard of that. I don't even know how to go about that, like, because it's the body. It's a gazillion diseases in the world. There is no possible way that you will ever know. And I'm talking about ever. You could be a nurse for 30 years and there are still going to be things that you do not know. And I think the sooner you accept that, the easier it is for you to kind of maneuver through your career path. A lot of times I feel like as new nurses, we beat ourselves up for not knowing enough or not knowing certain stuff. And it's just like, you're learning. It's a lot to learn as a nurse. I'm talking about, it is a lot. Different people carry stuff differently. Like, even though it may be the same disease process, it may not present the same in everybody else. And so I think they don't teach you that you're not going to know everything. And it kind of is set like the expectation to know everything. The way that they teach you is they teach you about a whole bunch of stuff. Some stuff you may never see in your entire life, but they don't preface it by saying like, hey, this is just us giving you a little insight on this topic or this disease process or whatever. It's more like almost like feels like you need to know everything. And the reality of it is, it's like once you pass your NCLEX, like you don't need to know everything. You need to know a little bit about most stuff, but like you're not gonna know everything. And that's why you have your colleagues, that's why you have doctors, like that's why you have people around you to kind of help you maneuver through certain stuff. But they don't tell you that you don't need to know everything, nor will you ever know anything. And that's another thing about nursing school that I will say, is that when you're in nursing school, it's literally, you're learning that stuff literally to pass the test. Like, that's it. I mean, like, obviously you want to know it for like future references, but depending on what school you go to, they may not be teaching you how you need to pass the NCLEX. And so a lot of the stuff that we learned, it's like I learned it so that I could pass the test in my class, but when it came time for me to study for my NCLEX, I learned stuff a completely different way. Because it was just it's two different ends of the spectrum. Like how a teacher may give a test is not how they're about to do it on the NCLEX. So you have a learning style specifically for school so that you can pass your test. That's what I'm trying to say. You'll have a learning style specifically for when you need to pass your test in school, and then you'll have a learning style for when you need to pass your NCLEX. And I don't think they teach you that. My school was kind of good about like giving us tests that were like NCLEX style so that we could get used to the questions. But I mean, it was like hit or miss. It depended on what teacher it was, because a lot of teachers would make up their own tests or whatever. So yeah, that part. They don't let you know that you don't have to know everything. And it's kind of overwhelming. Not kind of, it is overwhelming, feeling like you have to know everything only to realize that you don't. So I'm here to tell you, you don't need to know everything. Learn what you need to learn to pass your test and pass the NCLEX, and take that information with you. But once you start getting on the floor, don't feel like you need to know everything. Like, oh, now I passed the NCLEX, like I should be an expert. No. You have to learn. You have to gain like experience and build upon your knowledge. You're not going to get there and know everything, and you'll never get to a point where you know everything. And I think that's a good mindset to keep too, because once you get to a point where you feel like you know everything, that's when you stop asking questions, and that's when you start making mistakes. And you know, this license is very serious. We have people's lives in our hands. As you know, we do a lot of the work. Like the doctors may do the orders and diagnose people, but we do a lot of the work. So you got to be on your shit. Like you got to, doctors make mistakes too. Like they're human beings. And so you can't just go off of what they say. So having a know-it-all personality is not going to serve you in nursing. You got to always be willing to learn, always be willing to be corrected, always be willing to ask questions, never be scared. Like, yeah, they don't teach you that. And so don't feel like you're going to know everything, because you're not. So nobody ever explained this to me, and it was kind of just something like over the years as I kind of look back, and I was just like, damn, that all happened while I was in nursing school. But I developed, I don't want to say a lot of health issues, but I developed health issues, or a lot of my health issues like came out while I was in nursing school. Like I've never had a panic attack in my life, and I didn't have one until I was in nursing school. Like I remember the exact day, I remember exactly what I was doing. I remember the exact feeling of like, oh my God, like this is a panic attack. Like I'm really having a panic attack. Like that had never happened to me until I got into nursing school. Anxiety, I feel like I'm an anxious person by nature, but like that, pushing it to that level had never happened until nursing school. I also developed like stomach ulcers just from being stressed when nursing school. Like nursing school that's another thing that I want to pick up on. I mean, put out there that it's hard for no reason. Like it's hard in the sense of like, yes, you're learning about the body, you're learning about diseases and stuff like that. That is hard, but I feel like sometimes the programs go out of their way to make sure you know like this is hard when it didn't really need to be. Like when it comes to clinicals and them scheduling stuff, or like scheduling certain tests, or like, oh, you can't be 5 minutes late, or I'm locking the door. I just like a lot of the stuff, I was just like, this is unnecessary. Like y'all making it hard because y'all had it hard, and so now y'all got to keep up with the trend. But it was just like, I hated that, because it's like, it's already difficult for us. Like, I'm not saying that you should make it easy, but I'm also not saying that you should go out of your way to make it hard. So like when I was in nursing school, like, I don't know, I just developed like these health issues that I had never had because I was so stressed from being there. And I don't think anybody talks about that. Like, I feel like my anxiety heightened because of nursing school. My panic attacks, they happened in nursing school, and my stomach ulcers were developed from nursing school. So it was just like, it is really stressful. Like, and they do tell you that part, but I feel like they don't tell you that a lot of times it doesn't even have to be as stressful as they're making it. Like how strict they are, or like, no, y'all have to have class this day, or no, the test has to be given on this day, or you have to take your HESI or your, what's the ATI, like you have to take it. Like they are so stern and hard, I feel like, for no reason, because I guess they want you to be serious about it, but like, who is going into nursing school not being serious? Like, you're dealing with human beings. Like, you obviously have to know that that's a serious job. Like, why do they have to like keep reinforcing? I don't know. It just, to me, it was just a lot of like unnecessary stuff. And then also like the health issues that came with it. Like, I don't feel like anybody talks like that. Like, y'all let me know. Like, y'all developed any type of health issues while y'all were in nursing school, whether that be like physical ailments or like mental health issues. Like, nursing school can really wreak havoc on your brain. And I just feel like they kind of need to fall back. Like, yes, it's serious, but how they make it, it's just like, it's unnecessary. The last thing that I feel like they don't talk about in nursing school, and I guess that's, it just depends on the facility, but I've worked 6 contracts and I was also a staff nurse for 2 years, and I can say from experience, when you get into nursing, they don't care about like tattoos, like people who have sleeves. They don't care about piercings. They don't care about hair color. Like, they don't care about nails. As you see, I usually don't get my nails this long. I'm on vacation, but like when I go back to work this week, like, nobody's gonna say anything to me. Like, a lot of stuff that they like push on you in nursing school, like when you get in the real world, they're not making a big deal about it. Now, maybe like if you have administration around during the day shift, because I've always worked night shift, so I feel like they're a lot more relaxed during night shift. But nobody has ever addressed like, oh, having nails on, even if they're short. Nobody has ever addressed that. Or like, I've seen girls in there with like pink hair, purple hair, red hair. Like, nobody has addressed like tattoos. I've seen people with full sleeve tattoos on their neck. Like, they don't care as much as they make it seem like they care in nursing school. Some of the facilities may be different, but like I said, I've worked at 6. I feel like that's a sufficient amount of facilities to work at in my short time. And I've worked in different states, and I've seen all different type of things, and nobody is like making a big deal of it. The only time I could say like, and it's not even making a big deal, it's kind of like people like clean up like during day shift. Like, you might have managers and stuff around, so like people might actually, instead of having their water at their station, they're going to put it at the hydration station. But honestly, nobody is like tripping over that stuff like how they trip over in nursing school. Like, oh, you gotta have white shoes, or I mean, I guess it depends on your program, but like, oh, you need to cover this your sleeve up, or you can't have this many piercings, or you can't have hair color. Like, that's another point. Like, they make it hard for no reason. Like, this is stuff that's already on me. Like, granted, okay, like if you change your hair color, like that's something you can change, but like me covering up my tattoos, as long as there's nothing offensive like a swastika or something like that, like, okay, whatever. But I don't know, like they don't care in the real world. They don't. I wear Crocs to work. Nobody has ever said like, why do you have those Crocs on? They're the most comfortable shoes that I have, and nobody has ever questioned it. Like, people come in there not looking like whatever, but the things that they talk about in nursing school is not being presentable. In the real world, nobody cares. Long as you know your shit, long as you're a competent nurse, like, nobody cares if you have on nails. Like, long as they're not getting in the way of what you're doing or creating some type of like hazard. But yeah, I don't think they talk about that. And I think a lot of people might go into nursing like before they get in there, like, dang, I got this tattoo, or my hair is this color, or I got these piercings. And your nursing program, they may make it a big deal. They probably will, because again, they're just making it difficult for no reason. But when you get into the real world, none of that stuff matters. All right, y'all, so I think that's the end of the video. You guys let me know down in the comments below, like, what are some things when you got in nursing school that you were like, wait, what is this? Nobody told me about this. Or even those of you who are in nursing school, because I know the times have kind of changed after COVID. Y'all are probably back in the classroom, but a lot of it was like online stuff, and that, I know that had to be difficult. But like, yeah, let's talk in the comments. What are some things that you had experienced in nursing school that you were like, yeah, nobody ever told me this, or like, where did this come from? Because I know when I was in nursing school, I was just like, oh, okay, this is what we doing. So yeah, I hope you guys enjoyed the video. I hope that it brought some type of insight and it was helpful. And until next time, I'll see you guys later.